Why do 70% of global health agencies rely on the CDC's guidance? The Centers for Disease Control and Prevention, or CDC, has long been considered the gold standard in public health. For decades, its recommendations have shaped how countries respond to everything from seasonal flu to deadly pandemics. The CDC's influence stretches far beyond the borders of the United States, impacting the health and safety of millions, if not billions, of people around the globe. But what makes this agency so central to the world's health infrastructure? It's not just about the science. It's about trust, expertise, and a proven track record of responding to crises with speed and accuracy. Because its decisions impact disease control worldwide. When the CDC issues a new guideline, it ripples through hospitals, clinics, and government agencies on every continent. Doctors in Africa, Asia, and Europe look to the CDC for the latest research on emerging diseases. Health ministers in South America and the Middle East consult CDC protocols when setting up vaccination campaigns or responding to outbreaks. Even the World Health Organization often references CDC data and recommendations in its own global advisories. The CDC's reach is so extensive that a single change in its policy can alter the course of public health efforts in dozens of countries overnight. But what happens when the CDC itself is in crisis? Imagine the world's most trusted health agency suddenly thrown into turmoil. The very institution that's supposed to provide stability and guidance is now facing uncertainty from within. Employees whisper in hallways, unsure if their jobs are safe. News headlines question the agency's future. The sense of mission that once united the CDC's staff is replaced by anxiety and confusion. This isn't just an internal problem, it's a shockwave that reverberates through the entire global health community. In August 2025, the CDC saw its director fired after less than a month on the job. The abrupt dismissal sent shockwaves through the agency and the broader public health world. For many, it was a sign that something was deeply wrong at the heart of the CDC. The director's removal was not just a personnel change, it was a public spectacle, broadcast on news channels and dissected on social media. The world watched as the agency's leadership was thrown into chaos at a time when steady hands were needed most. Senior leaders resigned or were escorted out, and a venture capitalist with no medical experience was put in charge. This unprecedented move raised eyebrows both inside and outside the agency. How could someone with no background in epidemiology or public health be expected to steer the CDC through its most challenging period in decades? The new appointee's business credentials did little to reassure a workforce accustomed to scientific rigor and evidence-based decision-making. The exodus of experienced leaders left a vacuum at the top, further destabilizing an already fragile organization. Major staff layoffs and budget cuts followed. Entire departments were gutted overnight. Decades of institutional knowledge walked out the door as seasoned scientists and public health experts were let go. The CDC, once a bustling hub of research and innovation, now faced empty offices and demoralized staff. Budget cuts slashed funding for critical programs, forcing the agency to scale back its efforts at a time when global health threats were multiplying. The loss of resources and expertise made it harder for the CDC to fulfill its mission, both at home and abroad. Key programs tackling HIV, chronic disease, and even maternal health were shut down. Clinics that once provided life-saving care to vulnerable populations closed their doors. Research projects aimed at understanding and preventing the spread of infectious diseases were abandoned. The ripple effects were immediate and devastating. Patients who relied on CDC-supported clinics for treatment and support were left with nowhere to turn. Public health workers on the front lines found themselves without the resources they needed to do their jobs. The closure of these programs didn't just affect Americans. It had consequences for people around the world who depended on the CDC's expertise and support. The CDC's influence is global, and its crisis has far-reaching consequences. In an interconnected world, diseases do not respect borders. Air travel, migration, and trade mean that an outbreak in one country can quickly become a threat to many others. The CDC has traditionally played a key role in coordinating international responses to health emergencies, sharing data, and providing technical assistance to countries in need. When the CDC falters, the entire global health system is put at risk. But this isn't just an American story. The fate of the CDC matters to every country that relies on its guidance. In Africa, CDC-backed programs have helped control malaria and Ebola. In Asia, its research has informed strategies to combat tuberculosis and emerging viruses. In Europe and Latin America, the CDC's expertise has shaped vaccination campaigns and disease surveillance systems. The agency's crisis is a global crisis with implications for public health everywhere. The CDC sets standards that guide doctors, governments, and vaccine policies worldwide. Its recommendations are often the starting point for national health policies, shaping everything from how hospitals prepare for outbreaks to how vaccines are distributed and administered. When the CDC updates its guidelines, health systems around the world take notice. The agency's scientific publications are cited by researchers and policymakers in dozens of countries. Its training programs have helped build the capacity of health workers in some of the world's most vulnerable regions. When its leadership is unstable and its expertise is questioned, countries hesitate to follow its advice. Doubt creeps in. Health officials wonder if the CDC's recommendations are still based on the best available science, or if they're being influenced by politics or inexperience. This uncertainty can lead to delays in adopting new guidelines, confusion among frontline health workers, and inconsistent responses to emerging threats. In a crisis, hesitation can be deadly. The world needs clear, credible guidance, and right now the CDC's ability to provide that is in jeopardy. That creates confusion, delays outbreak responses, and weakens global coordination, right when diseases can cross borders faster than ever. In the past, the CDC has helped lead the charge against global health emergencies, from SARS to Zika to COVID-19. Its rapid response teams have been deployed to hotspots around the world, working alongside local officials to contain outbreaks before they spiral out of control. But with the agency in disarray, those efforts are hampered. Delayed airport screenings mean infected travelers slip through the cracks. Chaotic hospital emergency rooms struggle to keep up with surges in patients. And as diseases spread across borders, the lack of a unified response makes it harder to stop them. The U.S. has also withdrawn from the World Health Organization and slashed foreign health aid, threatening life-saving programs abroad. This move has left a leadership vacuum in global health, with other countries scrambling to fill the gap. Many developing nations depend on U.S. funding and technical support to run vaccination campaigns, stockpile medicines, and train health workers. The sudden withdrawal of support has forced clinics to close, left medicine shelves empty, and put millions of lives at risk. The world is now facing a future where international cooperation on health is weaker, just as new threats are emerging. Experts warn that this chaos risks eroding trust, slowing vaccinations, and allowing outbreaks to spiral. When people lose faith in public health institutions, they become less likely to follow advice, get vaccinated, or seek treatment. Misinformation spreads more easily, fueling fear and resistance. Hospitals become overwhelmed as preventable diseases make a comeback. The consequences are not theoretical. They are already being felt in communities around the world. The breakdown of trust in the CDC could have lasting effects on global health for years to come. The world is watching to see what happens next. Will the CDC be able to rebuild its leadership and restore confidence in its expertise? Or will the chaos continue, putting public health everywhere at risk? The answers to these questions will shape the future of disease control, not just in the United States, but across the globe. As new threats emerge and old ones resurface, the need for a strong, credible CDC has never been greater. So, will the CDC recover its leadership? Or could public health everywhere pay the price? The stakes could not be higher. The choices made in the coming months will determine whether the world is prepared for the next pandemic or left vulnerable to the dangers that lie ahead. Let us know what you think, and subscribe for more global health updates. Your voice matters in this conversation. Stay informed, stay engaged, and together, let's work toward a healthier future for everyone.